Hey everyone, thank you for joining us. I'm Jean.
I'm Chad.
I am the functional medicine health coach for Redesign You.
And I am a certified functional medicine provider with Redesign You.
And we're glad you're here with us today. Chad is going to give us an update on COVID.
So as everybody's seen, COVID is just going crazy right now. The numbers are, especially here in Arizona, the numbers are just rising very quickly. And so what we wanted to do is just to give a quick update of the most common questions that I get in the office. We're still seeing multiple COVIDs every single night. So the main questions that I'm getting is about testing, the vaccine, and then supplements, as far as if people are still to use those or not.
That's right.
So with testing, you have two different types of tests. You have the PCR and then you have the rapid swab. And the rapid, we'll get the results back within about 10 minutes, and the PCR can be anywhere from 1 to 3 days. So the big difference between these is that in order to have an accurate rapid, you really have to have been sick for about 3 days, but no longer than 7 days. So if you can get between that 3 day and 7 day window, then that's a really good test to do. And it is actually, they're coming out saying somewhere between 70 and 92% accurate if you're sick, not asymptomatic. If you're sick with symptoms and in that window, it's an accurate test. The PCR test, you could use the rule of thumb that you will most likely test positive 2 days before symptoms start. And that can actually stay positive, months if you don't clear it very well.
So rapid is generally what they do in the office, and it's in the front part of your nose.
Yeah, right inside the nose.
And then the PCR is the one that they go all the way to the nasopharyngeal area, and that's a send-out test.
Good job.
Would you explain why they have to go all the way to the back of your nose?
Virus colonizes. It builds its home in the back of that nasopharyngeal area. And that's why it's so difficult to catch sometimes, because it can move around. So when you check it on the just inside that we call interior nares, right on the inside right there with those rapids, it's about a 10 to 30 cycle difference. So you have to be very sick you have to have a high viral load in order for you to test positive right inside that anterior nares versus all the way up into the nasopharyngeal area.
So what you're saying is that when you put it all the way back here, it's actually more concentrated in the back portion of your nose.
That's where it's going to be the most accurate, yes.
Okay. All right.
Yes.
Anything else on testing?
No, those are pretty much your two options.
Okay.
That's about it. And so a lot of people want those rapids when they're asymptomatic, but just remember, you're sticking a swab in your nose, so just make sure it's going to count whatever you use.
Now, what about the antibodies? How can people find out if they have the antibodies? How will they know how long it lasts?
So are you talking about the labs?
Yeah, I guess.
So the lab antibody test is not really a way that we want to monitor COVID. However, the way it's supposed to happen is when you do get it, you are supposed to test positive for what's called IgM. M means that you have the acute infection. And then after about 3 weeks, you'll build antibodies against that virus. And at that 3-week mark, you should start producing IgG on the blood test. So if you want to know if you have some immunity, the IgG is the one that you would want to test. However, most of the time, for most people at least, it's not lasting more than 3 months.
Okay, and then, so is that what they're expecting with the vaccine, is for you to create that antibody load and it's only going to last for a certain amount of time, or do they know?
So nobody knows, but speculation is that the immunity from the vaccine will be greater than the immunity from actually getting the virus.
Okay, and what about this new variant of COVID that they say that they have found? Do you know anything about that? And do you think the vaccine is going to help with that variant?
Yeah, so viruses replicate all the time and they change. And so this is not something which is much of a concern for the medical community, except that this one seems to be more contagious. So the vaccine still should be able to build immunity against the so-called new strain or variant of the actual virus.
Oh, well, that's good. But should people still get the flu shot now, still?
Right. So the flu, we haven't had any flu at all. At least in our area, we haven't had any flu at all. And it's probably because everybody's taking such most people are taking precautions, wearing masks, hand washing, staying home, etc. But the flu is eventually going to come. And the concern with the flu coming right now is a couple years ago, the flu came much later, and it actually lasted all the way into July. So then the next flu that came, which was in October, November, was actually just this mutated version of the flu from before, which means the flu vaccines at that point don't work. So if you are considering getting the flu vaccine, you'd want to do it now rather than wait till next year, because it could be a mutated version because it's coming so late.
Oh, okay.
Yeah. Vaccines.
What are the potential side effects if you get the vaccine?
You just go right to it, don't you? Local redness.
That's what people want to know.
Yeah, so with the vaccines, local redness, swelling for the first vaccine. It's not supposed to be much more
Sore
than that.
arm, I've heard.
A little bit of soreness there. The second vaccine is the one where you're most likely going to get sick. And so the current recommendation is to consider taking 2 or 3 days off of work after your second vaccine, because you're most likely going to get sick. And so you may have some body aches, irritability, agitation, like your patience is nothing, and you may get a fever. With the vaccine, the big questions to get is what everybody wants to know. Should I get the vaccine or should I not get this vaccine? And start out by saying you should talk to your healthcare provider, okay? But with this vaccine, you really have to look at the risk versus the benefit. The thing to remember is this is not an approved vaccine. It's an emergency use vaccine, which could potentially save a lot of lives. So you really have to look at the risk versus the benefit. The risk of your health versus the risk if you get COVID. And that's how you really need to consider if you should get this vaccine or not.
And they're doing phases for the vaccine. So people under 65 with no health risks may have to wait a longer time before they can even get the vaccine.
Right. Right now so we were in a shortage, but now they've actually brought it to where we should have the vaccines in our area again. But again, you have to call your local health department and find out who's actually giving it and not. So with these vaccines, the biggest thing for people to remember with this is if you get the vaccine, you can still get the virus. You still get the virus, but you won't be symptomatic as much as you would be if you didn't get the virus. So the problem with that is if you still have a at-risk person that you're being exposed to that lives in your house or that you go visit or that you're taking care of, you can still spread the virus to them asymptomatically because you don't have symptoms, but you can still give it to them.
Okay.
Does that make sense?
Sure.
Okay. So you have to still wear a mask. You said to wear a mask. And if you get exposed to somebody who has the virus, you're still on a 10-day quarantine.
Oh, even after you have the vaccine?
Even after you have the vaccine. Because you've been exposed, you can still carry the virus asymptomatically because you've had the vaccine and can still spread it. So you still have to wear a mask and you'll still have to quarantine if you've been exposed. So supplements still, the big thing with the supplements is vitamin D. You'll hear a lot about vitamin D, and they've actually come out with some new papers saying that vitamin D status, if you are being admitted, is a precursor to determine how much of risk you are to develop complications from COVID in the hospital. So the big catch with vitamin D is that it's your vitamin D before you get sick. Because after you get sick and you're taking your vitamin D, you're only maintaining. You're not able to build that vitamin D back up. It doesn't get absorbed into the cell as well. So that's why vitamin D is a huge supplement you want to take before ever getting sick. And vitamin C is when you get sick. There's no reason to take vitamin C ahead of time.
And vitamin D helps with your immune system, right?
Yes.
Okay.
Yeah.
Thank you for joining us, and thank you, Chad, for giving us the update on COVID.
Yep.
We will be releasing another video, and Chad will explain what is functional medicine.
Which is my passion in medicine.
And you guys can check out our website at redesignu.net.
And then hit the subscribe button so that you get all the new updates. We're going to be putting all kinds of crazy amount of videos coming up. And subscribe and comments. We would love to interact with you. And she is a certified health coach. And so the interaction between us and you would be great. Help a lot of people out. So don't hesitate to send us comments.
Right. We're also on Instagram at functionalmedicine_life. So please join us. Thank you.